Does that mean I have to behave myself?
Yeah.
Oh, okay.
Uh-oh. I don't think I shared the right thing. Share. There we go. From the beginning. All right. So today I'm going to be giving an overview about the KPMs, talking about the guidance documents, the audit requirements that you all have to do every year, and then the entry into the operational profile. So, as you all know, school-based health centers are committed to high-quality, age-appropriate, accessible healthcare for school-age youth. And the annual KPM chart audit is a quality assurance improvement process that we implemented, let's see, in 2007 for sites to review client charts to assess whether or not they've provided the services associated with the KPMs to their clients. Okay, so here's kind of the cycle. You've got the identified services for the KPMs. You all are providing services. You're then analyzing your performance at the end of the school year by doing a chart audit. And then based off of those analyses, we hope that you make improvements. So the key performance measures, when they were originally developed, they were developed to have some consistency with other performance measures. HEDIS, CHIPRA, Oregon CCO metrics, UDS, and then the National Alliance. We worked really closely with the National Alliance when we were developing our KPMs based off of the performance measure work that they were doing at the time. And the ultimate goals, again, of the KPMs are to increase the provision of really important preventive health services. The really great thing that I have loved in my time working in the school-based health center program is the impact of the KPM audits on the school-based health centers and ways to improve really its documentation. For example, or just other kinds of areas of improvement. So one of them is like modifying their clinic workflow to make sure they're asking the clients, for example, if they have had a well visit recently, if they want to have a well visit. It's really helped to improve and increase collaboration between primary care and mental health, behavioral health providers. Some sites have developed like a mechanism for the mental health folks to refer clients who might need a well visit, other primary care services, even dental services. And some sites do a monthly or a quarterly review, an audit to see how they're doing actually on providing the services, see if they throughout the school year need to potentially make some changes to try to make sure they're offering more clients the services associated with the key performance measures. And then this is what I started talking about was EHR documentation. I know that one of the things that some sites have said is that they needed a consistent place of where they're going to document in the client's chart whether or not a service was offered, refused, provided. One thing that really helps with is when you get ready to go and do your chart audit, it saves staff time because there's a consistent place that you all are documenting different things, so you don't have to look in a bunch of different places in the chart when you're looking to do the chart audit. Okay, so just the basics, KPM requirements. All sites are required to audit 2 core measures, and those are the well visit and the health assessment. And then we have we have 8 different measures for an optional measure for you all to choose. I'm going to get into all of those optional measures and talk in more detail about how you select an optional measure and that sort of thing. Like I said, every year sites have to submit an audit process, and they have to randomly select a subset of school-age client charts. that were seen during that previous year, and those will be part of their chart audit. The sites have to submit their audit documents and the results, and the statewide benchmark that we ask sites to try to meet is that 70% of the charts that you audit are in compliance. Okay, so here are the core and the optional KPMs. Like I said, the well visit and the health assessment are required, and all sites have to audit for those services. And then here's the list of optional measures that you can choose from. We have adolescent immunization that includes Tdap and meningococcal. We have an adolescent teen series, which is HPV, Tdap, and meningococcal. Chlamydia screening, depression screening, flu immunization, HPV immunization, nutrition counseling, and substance use screening. In my presentation, which I'll be sending out in a PDF form, I've got links to our website, the data requirements page in particular, where you'll find more information about the KPMs, because I tend to talk a little bit fast.
Yes, you do.
Can't help it. I'm just a fast talker in general. Okay, so the optional measure that I mentioned. Optional measures are tracked for at least 2 years, because what we really want to see is that as a result of doing a chart audit, maybe you realize, like I said, some of those things like clinic workflow needs to change. So if you were only track an optional measure for 1 year, it's not going to allow you to implement change to try to increase the provision of the service associated with whichever optional measure you've chosen. So you track them for 2 years. You can choose every 2 years to continue tracking the same optional measure. It's perfectly fine. We don't say you have to change them. Some sites feel like they've totally done a great job on making sure their clients are getting one of the optional measures, and they maintain that kind of workflow, and so they decide to choose a different optional measure after 2 years or 4 years or whatever, but it's your choice. And the timing of it is that we correspond it with like the biennium. So this upcoming one is 2023 to 2025, which means sites are going to need to go into the operational profile and document in the OP which optional measure you're going to track for 23-25. And I will get into that. I've got some screenshots. Folks who know me know that I love screenshots, to kind of step you through what you need to do and what it looks like in the operational profile when you're selecting.
And they're helpful, by the way, Loretta. I want you to know the screenshots are very helpful.
Okay.
Very good. Thank you. So 2023 is when we're going to have to go in now, right? At the end of this year and select it for the next biennium.
Yep, that's right. Yep. And I'll send a reminder out letting you all know that, that next date is July 15th of just this year. When you're selecting an optional measure, and this kind of gets a tiny bit into the weeds, we want to make sure that people are selecting an optional measure that the target population for the optional measure are clients that you're seeing in your school-based health center. So let me give you an example. So if you're seeing elementary school age kids, you're not going to want to select one of the teen immunization series, because you're unlikely to have at least 20 clients in the particular age range for the teen immunization series. I'll go into that a little bit more further down the line, and I've got a good table to show you the different ages for the different measures. And as always, you can email me or give me a call and we can talk through it. And so here it is. Okay, so this is, I think it's a nice visual representation for the age ranges for the different KPMs. And most importantly, I want you to look at the optional ones. But so for the health assessment and the well visit, it's all clients 5 to 21. And then as you can see going down, one adolescent immunization series, the Tdap and meninge, is just for 13-year-olds. And then you see some other ones are for 13 to 17-year-olds. There are 2 optional KPMs for the full 5 to 21 year range, and that's flu, immunization, and nutrition counseling. So like I said, when you are going to select an optional KPM, I think that this little table is kind of useful because you can see who that optional measure is focused on, and you think about the clients that you're serving at your school-based health center.
And we only have 2 options for the for the elementary age.
That's correct. Yeah. At this time, that's true. Okay, and so here is my screenshot of what it looks like in the operational profile when you go to add an entry for a new biennium. And you can see here in my example that I've got 2017-19 chlamydia screening, 19-21 was chlamydia screening, 2021-23 was HPV. And so you would go in and hit that add optional KPM button. And then a little window will pop up down below like you see, and you'll select the biennium as a drop-down and just do one of the little buttons to indicate which one measure, and you can only select one measure for the purpose of entering it into the operational profile. Some school-based health centers do track multiple optional measures. That's their choice. They just go ahead when they're doing their audit. They do that. They just will only submit to us the results for one of the optional measures. And then there's a little checkbox, and you'll put your name saying that you confirm that that's what you're selecting. Okay, so this is the timeline kind of across the service year. So July 1st to June 30th is the service year. And so you all work on increasing the number of clients that have well visits, that get health assessments, and then the service associated with the optional KPM. Typically during the summer, a lot of sites will then do their chart audit and analyze the previous school year's visits. Some sites are closed during the summer, so they do their audit in the fall. But October 1st is the deadline for when you need to submit your results first to me for me to review them, and then you will enter the results into the operational profile. And I will go through that later on down as well in the presentation. And really, throughout the year is when you should be making improvements on, like I said, on different ways to make sure you're offering the services to your clients, following up with them, documenting in the chart. And then there's the note about every 2 years, you'll select in the OP a new optional KPM. So that's just a nice little cycle there that you can see. Okay, so I'm going to pause. If anybody has any questions, you can look at my picture of Mineral Lake when we went fishing 2 years ago.
Wow.
Does anybody have any questions? Yeah, go ahead.
I do, and that has to do with what you mentioned about the KPMs being more in alliance with other performance measures. Mm-hmm. And I would go as far as to say it would be very nice if we could have some kind of a alignment with the HRSA and the PCPCH, right? Because we have those things annually, and we're getting ready for a PCPCH, and I don't know how that's going to go.
Sure. Yeah, I totally hear you. And I will say that at the end of next biennium, I think is kind of what we're anticipating. We're going to do a KPM review. We'll do it internally with our team, and then we'll do a work group. I can't say exactly if that will be the timing or if it'll be like the beginning or the first year of the 25-27 biennium, but we will have a work group. We will really encourage folks to participate. If they can, we'll send out a survey to get feedback for folks who can't come to the work group. But I totally hear you, Ceci, and that is that's a very good point, and something that that would make sense, because we understand that you all are having to report on a variety of different measures already to different entities.
And I don't think the PCPCH knows what we do very well.
Okay.
I think that doesn't, at least that's the sense I got.
Okay. All right. Are there any other questions? I will, I'll move on if not.
Hi, yes.
Yeah.
I'm not sure. I'm clicking the hand raise button and I can't tell if it's working or not. I'm wondering, going back to the random, I've been working all year long on getting a report that is accurate to send out monthly, and I'm having the hardest time. So when it comes around having to submit the KPMs, is it like, say we're at 70% or 80% for meeting our health assessments? Who is so the random? So if it's random, so is that just like picked out of a computer? Like, I'm with Clackamas County, so I'm sure you guys know how we pick ours.
Yep.
Is that just a random toss? So the luck of the draw could mean you get your, you get the 30% and you might be at 2%, even though overall you're at 70%. Is that correct?
Yeah. So sites can audit. If you've got a report that you can run, you can submit the results for every single chart, for every single client that was seen last year. So it really depends. Not all sites have the ability to develop a report like that. Depends on your EHR and the sophistication of it. If it's a consistent place and a reportable field where you collect the information. But you and I can talk about that one-on-one. I saw your email, Tammy. I just haven't had a chance to get back to you. So yeah,
we've had the hardest time getting it accurate. So thank you.
We can totally set up a time and you and I can talk about that for sure.
Okay.
Awesome. Okay, I am gonna go on. So here I'm going to talk really briefly about the guidance documents. I don't want to spend too much time getting in the weeds. I'm really good at getting into the weeds, but there are a lot of slides that I want to get through. This right here is a screenshot of what the data requirements part of our SPO website look like, the KPM information in particular. You see that there are guidance documents. If you click on those links, it's going to take you to what I'm going to be actually showing you some of the different some of the information that's on the guidance documents, but it'll go into detail about each one of the optional measures, the health assessment, and the well visit. It also has a spreadsheet that you can use for when you're filling out your chart audit results and submitting them to me. There are links to those as well. Okay, so quickly, every guidance document includes description of the measure, which talks about what the service is, who the eligible population is. You saw that table that I created that breaks down the age range. There's a little bit more than just the age range for some of our eligible, for some of our optional KPMs. And I'll have a tiny bit of time to get into that, but we've done a pretty good job with the guidance documents of being really clear, providing CPT and diagnosis codes where appropriate for the different services associated with the KPMs. We've got exclusion criteria in there. And then, like I said, there's diagnosis and procedure codes, and then just some of them have some FAQs, and we have provided some resources. So each guidance document has all of that information. I'm going to buzz through this. This is screenshots from the well visit guidance doc. There, like I said, measure description, eligible population. Really important to look at the eligible population when you're doing your audit itself. It's really important. I want to make sure you all also realize that all clients, physical, mental, behavioral health, dental visits, all of them should be included when you're doing your chart audit as the sample for you to audit from, not just primary care patients. Like I said, there are exclusions. It's a lot of information. I don't have time to go through it. High level, client refuses, parent refuses, 2 documented no-shows for a scheduled appointment, like when they were supposed to get a well visit. If the client requests a confidential visit and the school-based health center is concerned that it might violate their confidentiality just by asking for a non-school-based health center provider to give information like about a well visit in particular. So I know I'm going through these quickly, but all of those documents are posted on our website, the guidance docs. Like I said, measure specifications. And then here's a little bit more information on each one of the guidance docs. You'll see that. This is also a really important table because when you're actually getting ready to, when you're doing your actual chart audit, the really tricky things sometimes are when a chart should be excluded.
Yes.
And yeah, that's the hardest part. And yeah, I know, right? And I think, I think maybe this is something that I need to email out just like this table when I'm reminding folks about when the audits are coming up. So I wish I had more time. This webinar could probably actually be 90 minutes. I don't know how many people, enjoy listening to somebody talk about a data requirement like I can, but there's a lot of information and I recognize that. And I guess really what this hour is for me to, have a little bit of depth, get into a little bit of depth for you all, but also hopefully will bring up questions for you to ask me and for us to talk on the phone. I'm always available to talk on the phone, email back and forth. And all questions are good questions. So please always ask. Okay. That was really fast because I'm feeling stressed. Like I've just been talking an awful lot. So here's Trillium Lake. Anybody have any questions?
No, I think that table will be so helpful because we are one of the sites that we review all of our charts.
Yep,
we review everything because of that very thing. Sometimes you get a sampling that you don't look so good. So if you do everything, so that's very helpful to identify what are we to understand how the
exclusions.
What all the exclusion means.
Yep. Exactly.
And then no shows. And the other thing I had a question on was being able to chart in Epic, Ocean Epic, when we have done the outreach and the students just like, I don't want to do it, and refused. So refuse, and if they refuse, are they excluded?
Right. Yeah. If they refuse, so I remember that before SAS talking about outreach. So outreach and just saying, okay, we've got these services. That's not the same thing as you saying to a client, okay, are you interested in getting a well visit? Specifically, in a visit. That's the extra thing. So you can't automatically say that the chart should be excluded and count as a refusal. Just because they got information about services that you do provide at the school-based health center.
No. We actually talk to them. The front office coordinators are talking to them and asking because we have that envelope by age in Spanish or English. And in it, if they say, yes, I'm interested, so here's the paperwork to send it home. There's your medical history. We can do a combined sports physical with it if you'd like. But sometimes doing that doesn't necessarily translate into a visit, right?
Correct. Right. Yep. Okay. I am going. Go ahead. Was somebody gonna ask a question? Go ahead.
So going back to that, I mean, this is like the bane, right? The bane of my existence right now because I'm so competitive for one thing. Plus, it's just best practice to try and get all these done. The exclusion criteria. I know you and I are going to talk about a report, but so I'm sorry, I didn't get who was talking, but
Sophie, yeah.
Our goal right now is to, off these reports, to call kiddos in, bring them in, ask them if, let them know about services, but also, I mean, this will be under a scheduled appointment. If they refuse the wellness visit or they refused maybe even to do to do the health assessment, if that's documented in the chart somewhere, does that that counts. I just want to clarify if they've
Yes,
declined.
that counts. If they decline, if they refuse a service, then as long as you document it in the chart that they've refused, then that chart is excluded, right? So what I will say a lot of Ocean Epic sites do is they run a report, and all the ones that say they're not in compliance for any of the measures, they go back and specifically look in those charts to see, is there documentation somewhere? And that's where the importance of where you document it and being consistent and the wording and that sort of thing.
Yeah.
So that's really,
So but this can just be documented in, like, say they decide they don't want to be seen. It can be documented in an encounter, like an interim note. I mean, or does it have to be within a visit that they've declined? Like we've talked to them?
No, if it's in their medical record anywhere, I'm not familiar enough with the different areas in Epic or anything to document that. But if you have it documented in the chart that they've declined a service, wherever you can document and go and reliably look for that information when you're doing the audit, yeah, that's what matters. It's
But
not
it
just
has to be, but it either has to be pullable by our Epic, or we have to go in there and manually do
Correct.
the report, fill out the report to be
Mhm.
able to show you.
Yeah, well, I mean, so you don't have to send me the exported report, right? I mean, I
'Cause
know
we-
what your output looks like, so maybe you and I need to talk.
Yeah, we will. Sorry.
Yeah, no, that's okay. No, I
Can
know.
I just verify one more thing? Can I
Yeah,
verify
sure.
one more thing? We had a lot of, confidential visits, and we don't have parent consent. So
Yes.
so those, okay.
Yeah.
So we
Yeah, so if
can
they're-
then exclude those 13, 14-year-olds.
Yes,
Hopefully not a lot of
because you
13-year-olds.
can't, absolutely, because you cannot, yes, because that, absolutely.
Or if
those
we
will be
did not
excluded.
have, or if we didn't have, say they came in for something, an ear infection, and we just had so does it have to be written consent? Or, we get a lot of freshmen that come in that are 14, and we don't actually, we do an administrative encounter saying we've talked to a parent. They can be treated, but do we need a written consent in order to do a health assessment?
Well, it's whatever you all need for your purposes to be able to provide those services. Yeah, that's on the clinic, and however you all make the determination for when you'll be providing services and what type of consent you get from the parent, if it's verbal on the phone. Yeah, so that's
okay.
Yeah.
Loretta, maybe I can help with that, because I understand exactly what she's talking about.
Good.
We've been there. There is an opportunity to use a dot phrase in Epic within the family comments and snapshot, and you document it right there. So you don't have to be searching all these charts at the end of the year, looking for the compliance,
Nice.
Did we do it? Did we not? So that's one way to do it.
Oh my gosh, we've had the worst trouble getting our dot phrases to actually pull correctly. So that's why I need to talk to Loretta offline so I can know what counts.
Yeah.
Dot phrases have not been working great, though.
Okay.
Yeah.
All right. So now we're going to get into what you all need to submit. We're going to get into the details of what you need to submit to me. So like I said, you're going to do a retroactive chart audit for the previous service year, looking for evidence in the chart that the services were provided. And like I referenced here, clients age 5 to 21, so you're not auditing for charts where they're younger or older than the age range. Again, for the eligible population for the optional measures, that's what you have to pay attention to for the age of the client. There's just, the minimum number of charts that we want to be audited is 30 charts. The upper end is 50. And the way you figure out that number between 30 and 50 is you calculate 20% of your unduplicated client count in that age range. I can help folks with that. if they need my assistance. And we, it includes telehealth visits. So clients that have telehealth visits, we need those to be included as well for the chart audit. Okay, so like I said, 20%, minimum of 30, max of 50. And as folks have heard me talking, some school-based health centers audit every single chart because they've got a report set up that they can run, and it provides the breakdown of how many charts were in compliance for each one of the measures. I wish I could figure out a way to run a report, to develop a report for everybody, but because EHRs are so different, I'm unable to do that, and we can't do that with the encounter data you all submit to us. We wish that we could. And another slightly tricky thing is when there's an outside mental health agency, it's different from the medical sponsor. Coordinating with that mental health agency to do the KPM chart audits. I can work with you all if you're having any challenges with that, because it can be complicated enough just doing the chart audit on your own clients, the medical sponsors clients, but also working to make a smooth audit for working with outside mental health agencies. I'm not saying that the outside mental health agencies are difficult to work with. I'm talking about just the physical actual audit and the challenges of the audit itself. I mean, for those that have been around for a while, you know that it can sometimes be difficult doing the audit, and that's why I do this presentation every year, try to help. Okay, so like I've kind of been talking about, if a client isn't in the eligible population, then they should not be part of the audit. So what you'll have to do is select another chart to audit. And that's where, when you're looking at the optional measures and the target age range for the different measures, that's where you need to take into consideration if your optional measure is 12 to 21-year-olds and a chart that you've selected is a 7-year-old, you're obviously not going to be able to audit for that optional measure because they're outside of that age range. So I kind of ran through these really quickly before about when to exclude from the audit. Client refuses, parent refuses, unable to get consent for client under 15 years of age for medical services, or under 14 years of age for the mental health, behavioral health KPM or the client. 2 no-show appointments need to be documented in the chart, and then that chart is excluded from the audit. There are 2 KPMs where you can get documentation from an outside provider that a service occurred, and that is only the well visit or chlamydia screening. All the other KPMs have to be performed by school-based health center providers. So if a client says, I had a well visit with my primary care doc and I don't need to have one with you all, if the client agrees for you to, does a release of information, and you can reach out to that outside provider to get a copy of that well visit and incorporate it into the school-based health center client chart, you can do that. If you're unable to get that record, then that chart is excluded. And if a client requests a confidential visit, like we kind of talked about already. So those are just for the well visit and the chlamydia screening. I know I'm talking, yeah.
Yeah, I don't know if the other sites has the same difficulties, but for us, it is nearly impossible to get a provider to fax to us, even with an ROI. We are not a priority. Sure.
Yeah,
right?
So then that's where you have to document in the chart, unable to obtain the records. And that chart is excluded. You don't have to do a replacement chart. It's just excluded. Okay. just make sure and that's where it all goes back to having a consistent place. You said it, Tessie, a consistent place to document a refusal, anything like this. So when you all go back and do the audit, you know where to look in their medical record. Okay, so really quickly, here are 2 optional measures that are a little bit different for the eligible population. The depression screening. The focus of the depression screening is to increase screening for clients who do not currently have a mood disorder. Because if they currently have a mood disorder, you are regularly getting depression screenings done with them. We're really wanting sites to expand and get depression screenings on young people that don't have an active mood disorder. And then chlamydia screening. While we know it's really important to do chlamydia screening on male clients, the current key performance measure is just on sexually active female clients. Not to say we don't want you to be screening your male clients, but for the purposes of the audit, it's just female clients who are sexually active. Okay, so for sites that choose an optional immunization KPM, you don't audit the charts, you don't look up an alert to see if a client has received whichever the shots associated with your optional measures. So like flu shot, you all are not auditing for that. What you're doing is you're submitting to me a spreadsheet with patient name, date of birth, gender, their full address for all the clients in that eligible population age range. The alert program will review for us, look up all of those clients and match them in alert and let us know if the client is in compliance, and then I actually enter in those results into the operational profile, and I provide the results back to the sites. So that's one thing about the immunization KPMs for the optional ones. Okay. Any questions? I'm going to go on. Okay, so what you all have to submit to me every year, I need the process, a narrative description of your process for doing your chart audits. You have to explain to me how you selected the charts, what criteria you used to select the charts, and then when you were reviewing the charts, what you were looking for. And that's where you need to really use the guidance documents, because those guidance documents, if you look through them, it tells you how to do your audit. But I need you all to write a narrative describing it to me, because you might be surprised that people don't follow their own audit process, what they've submitted, how they say they're doing their audit. And you have to submit that process to me for approval. I really recommend you have me review the process before you do your actual chart audit, because if you've made mistakes in your process, but you've gone ahead and done your audit, I will tell you, you have to go back and do your audit again. And I really feel terrible about doing it, but I have to. So save yourself time and submit the chart audit process to me before you do the actual audit.
But we only need to do that if we are doing the random selection. If we are auditing all the charts, there is no.
Yes, except for, I think you and I had some emails back and forth last year about the criteria that you used for if a chart was excluded. So like exclusions are really important, because if you just run a report and you just tell me how many were in compliance and not in compliance, I don't know what criteria was used in order to make that determination. So I still do need to know. What I don't have to get is the tracking spreadsheet, where it's a grid of every single client, their age, all of that information. If you're auditing every chart, I don't need a giant tracking spreadsheet with each client's patient ID number and if they are in compliance for each one of those. But I still need that narrative process that that explains, do you see what I'm saying?
Would the comments on that spreadsheet answer that question as well, though?
Well, so But so if you think about that, I have 83 school-based health centers that are submitting their audit tracking sheets to me. That narrative process and that narrative outline of what you've done for doing the audit and what criteria you're using to determine if a chart is in compliance or not, if it's excluded or not. Yeah, it takes me a lot of time. So yeah, I know and I really encourage sites to talk it through with me if they're having a difficult time trying to figure out what should be in that audit process. Yes, so ask me questions often and early. Okay, so here, this is what I was talking about. So what I need to know is how the charts were identified. If you ran a report from your EHR, like, birth date range criteria, because it's 5 to 21 for like the well visit and the health assessment, and then depending on which optional measure you choose, that age range is different. How you randomly select charts. I have a little website that I can send you all a link to randomly select numbers, but just reach out to me for any of these parts, because this is definitely, the audit process document is definitely one of the trickier ones. Making sure you're thinking through all the different things you need to for when you're actually doing the audit. On our website, I do have a blank spreadsheet that you can use to fill out the results of each chart that you reviewed. I've got a blank one, and I also have one with fake data populated in it. And there are all these columns. There's a patient ID column, an age, a column whether or not they're compliant or not for each one of the measures, if the chart was excluded, and if the client had only in-person visits, telehealth only, or a combination of both. And right here, I will be getting to a spreadsheet, a sample spreadsheet. This is actually what the document on the website looks like. It's an Excel doc. This is a lot of information, and it's really not fair for me to just present this and buzz on by. But my concern is me not being able to get through everything in this presentation, and I can always come back to this, and you also can reach out to me directly. I try really hard to give you examples of when you need to select a replacement chart, whether or not a chart is excluded, like I said, because a client refused or what. But I am going to buzz by this, and I apologize. Okay, so like I said, sites will typically begin doing their audits in the summer, especially for sites that have only been open for 1 full year. I encourage you to start the audit in the summer. We've got several new school-based health centers that have come on board this year. You will not be required this October to submit KPM chart audits. You will do that next year because you need to have a full year of being open and providing services before we expect you to do the KPMs. So if we've got new folks on here, welcome. You don't have to do them this year, although you could practice. You could do a practice audit and figure out kind of how you will audit for next year, or you can just wait until next year. Everything needs to be submitted into the OP by October 1st. And before you can submit them into the operational profile, I have to approve and sign off that your documents, that I've reviewed your documents and they are good to go. You can't go in and enter your results into the OP until I unlock the KPM button. And I'm going to get to the KPM entry in just a minute so you can see some screenshots of what it looks like. That was so fast, people probably didn't even have a chance to digest it and ask questions. I really do think next year I'm going to make this 90 minutes. Okay. Here we are, operational profile entry. So like I said, after you send me your audit process and your tracking sheet, you'll be able to enter the results into the operational profile. This is what the OP looks like on the KPM tab in the database. You will press that Add KPM button, and this will pop up where you're going to select the fiscal year, so it'll be 2022-23, the number of charts that you reviewed, and the number that were in compliance. So for the number of charts that are reviewed, you're not going to include charts where the client refuses if they weren't in the population or if they were just ineligible for the chart audit. So let's say I'm going to give the example of depression screening. So you pulled 50 charts to review. You had 20 clients refused the depression screening. You will actually lower your denominator by the 20 refusals. So even though you actually pulled 50 charts to review, only 30 of those were actually reviewed because clients refused. So let's say you had 15 of the 30 did get the depression screening. In compliance would be 15 and reviewed would be 30. And that is the messiest part. And, you know, and I don't know, Ceci, how many times do we talk about it because it's confusing? It's really confusing. It is. Yes. And I'm only saying because you and I talk about it, because you only do this typically once a year. Like, why else would, you know, it's hard. And so I really encourage, especially new folks, please don't feel like you should be figuring this out and understanding it. It's tricky. So please call me, email me. And so here's an example of the calculation. It'll give you the percentage, and that data is entered into the database. So we've got historical information. But that's what one looks like when it's filled out. Now, let's say you have you've forgotten that you have to send your audit process and your tracking sheet to me to review, and you go into the OP and try to add in the results of your audit. This little screen will pop up saying that the entry is locked. Now, I also will admit sometimes I am so swamped with reviewing everybody's entries that I might have approved it and I forget to go into the database and unlock your KPM entry button. And I apologize in advance if that happens, because it definitely has happened from time to time. There are a lot of documents that I'm reviewing, and so I appreciate grace, and just shoot me an email and I will unlock your entry for you. Okay, this is like, I think this is my last slide. These are just the reminders and helpful hints. The button is locked in the operational profile until I approve your documents. Please, please, please submit your audit process before you do your actual audit. I will save you time, I promise. Your audit tracking sheet, the spreadsheet, should be submitted to me via secure email. I can initiate a secure email that you can reply and attach that document, or you can send it to me through your secure email transmission. October 1st is the deadline to submit results into the OP. And here is another link to our website. Our operational profile user's guide does have step-by-step screenshots, of course, and how to select your new optional KPM and how to enter the results into of the audit into the OP. So that user's guide is also posted on our website. Okay, last chance for questions. I am going to, this Crooked River, we fished there too. I am going to stop sharing my screen. And I am back. Last minute. Look at that. 6 minutes. I will make this longer. I've said that, I think, 4 times. So whoever, people who listen to this recording will think that I'm a broken record. But wow. I don't know what. Let's see. Oh, that's a transcript it's showing. That's really weird. I'm like, what was all of that? But that was just me talking and talking. Okay. And I probably should stop the recording, but if anybody has any questions, now's the time.
Yeah, no question, but I think those some of those slides you showed today will be very helpful when we're trying to put together this key performance
Perfect.
measures.
Yeah.
And the more explanation you can give about what decline is, what a refused is, what a population is, would be helpful.
I will totally do that. And actually, when I send out the announcement that the recording is posted, I will include those 2 tables in the body of that email.
That would be great.
And then I'll send them out again this summer for folks who are working on them. Y'all don't hear from me very often in the summer, so I'll send that email out this summer too with some reminders. I'm going to go ahead and stop this recording.